we talked about upper GI disorders and liver and pancreas disorders, and we're just going to briefly touch on lower GI disorders. There are no learning objectives for this section. It is optional. It is not something that obviously we're treating a lot. Interestingly enough, though, whenever we do group presentations in class, people like to pick irritable bowel syndrome. I don't know why, but that's a popular. We've had people even groups even write songs and perform them for their presentation. So it's a popular subject, even though this is an optional section. Okay, so a common autoimmune disorder is celiac disease. It's a malabsorption syndrome. It's a defect in an intestinal enzyme that presents the further digestion of gliadin, which is a breakdown product of gluten. It has a toxic effect on intestinal villi, causing atrophy of the villi. So remember, the villi are the convoluted parts that allow you to have a lot of surface area for absorption. And so it decreases your surface area for absorption. And so malabsorption and malnutrition can result. And it's diagnosed by a series of blood tests. Usually the treatment is a gluten-free diet. So if something is causing an autoimmune disorder, don't eat that thing. And gluten-free, it's easier to eat gluten-free now because there's more gluten-free stuff available in the marketplace. And intestinal mucosa usually returns to normal after a few weeks without gluten intake because that mucosa has the ability to regenerate itself, right? It has mitotic cells. And so people who have celiac, there's full-on celiac and there's low-level celiac. People who have celiac can live a perfectly normal life with a gluten-free diet and not have symptoms, which is great, and their intestinal villi can regenerate themselves. Chronic inflammatory bowel disease, there are lots of different forms of it. Crohn's disease and ulcerative colitis are chronic inflammatory bowel diseases. Causes unknown, or there are some that are autoimmune, some that are other things, but it's Crohn's disease often is first detected during adolescence. There appears to be a genetic factor involved. Ulcerative colitis tends to show up later in life when you're second or third decade. There are lots of similarities between Crohn's disease and ulcerative colitis, if you look at this chart from the book. But they can be very disruptive to your life, basically. So usually the treatment of inflammatory bowel disease is a team approach. Anti-inflammatory medications, anti-motility agents, nutritional supplements, antimicrobials, immunotherapeutic agents if it's an autoimmune disorder like Crohn's, and sometimes surgical resection of the damaged areas of the ileum or the colon. So usually it's an ileostomy or colostomy, or sometimes they remove the individual section that's damaged and join the two remaining parts together. So hopefully it doesn't come to that if you can manage it. There are definitely more immunotherapeutic agents available to manage IBD, and people have good success with it. So that's good. Appendicitis is a more acute issue. The signs and symptoms are periumbilical pain, so pain around your umbilicus related to the inflammation. Nausea and vomiting are common. Pain becomes severe and is localized in the lower right quadrant of the abdomen. You get that rebound tenderness, and it's because of involvement of the parietal peritoneum over the appendix. So usually appendicitis is treated by surgery. Peritonitis is inflammation of the peritoneal membranes. Chemical peritonitis can result from enzymes that are released from the pancreas when you have pancreatitis. It can result from other ruptures or perforations, ruptures in the bladder, ruptures in the stomach, ruptures in the gallbladder. So when stuff ruptures, chemicals get where they're not supposed to be, basically, and you end up with peritonitis. It can be caused by blood bringing foreign material to the area, or any other foreign material in the abdominal cavity. And it's serious. You can die from it. So it's definitely to be avoided. And bacterial peritonitis is caused by direct trauma affecting the intestine, like a ruptured appendix or an intestinal obstruction, and gangrene. So gangrene is when we have tissue necrosis with bacterial infection. If you recall from way back at the beginning of 273. So any abdominal surgery, if foreign materials left or infection is introduced, can cause peritonitis. Pelvic inflammatory disease in women can happen if you get infection reaching the cavity through the fallopian tubes. So lots of things can cause peritonitis, and it is quite dangerous. A lot of times it is a complication of abdominal surgery. So sudden severe generalized abdominal pain, localized tenderness at the site of the underlying problem. Vomiting is common, abdominal distension is common, dehydration and hypovolemia, and low blood pressure from the vomiting. Decreased blood pressure, tachycardia, fever, and leukocytosis from the infection, from the bacterial infection. Treatment depends on the primary cause, but it might be surgical treatment and massive antimicrobial drugs specific to the causative organism. So it's very important to get treated because it can kill you.